Gentlemen, I want you to imagine waking up tomorrow morning with a firmness you haven't felt in years, without pills, without pumps, without risky treatments, just by using your own hands and a few minutes of simple, precise stimulation to awaken your body's natural erection mechanism. I am Dr. Lauren Hart, a urologist with over a decade of experience helping men reclaim their sexual vitality. And today, I'm going to show you 3 specific pressure points on and around your organ that can help restore your morning erections by improving blood flow, relaxing the right muscles, and boosting nerve responsiveness. If you've been missing that automatic morning lift, stick with me because by the end, you'll know exactly where those points are, how to gently stimulate them safely, and how often to do it to get real results. The science behind the stimulation. Before the where and the how, you need to understand the why. Once you know the science behind this, you'll realize you aren't just pressing skin. You are activating one of the male body's most powerful systems. Erections are not random, nor are they purely mechanical. They result from a carefully coordinated dance between the brain, spinal cord, blood vessels, nerves, and muscles. It all begins with tiny nerve signals, electrical messages that travel at high speed from the brain or sensory nerves to the erectile tissue. These signals tell the smooth muscles inside the penis to relax, allowing blood to rush in and fill the spongy chambers called the corpora cavernosa. As they fill, the veins that normally drain the blood are compressed, trapping it inside and creating firmness. This is where age changes the game. Over time, blood vessels in the pelvic region can become stiffer due to less elasticity in the arterial walls, a process accelerated by wear and tear, low-grade chronic inflammation, or conditions like hypertension. At the same time, nerve conduction slows, meaning the electrical messages no longer travel as quickly or as strongly. This dual impact, slower circulation and weaker nerve signals, is one of the main reasons why morning erections begin to diminish after age 50 or 60. The targeted stimulation of pressure points works because it sends an immediate wake-up call through your nervous system. By pressing or massaging specific spots, you activate clusters of sensory nerve endings that tap directly into reflex pathways linked to erection control. These signals don't just stay local, they travel to the pelvic nerve plexus and even the sacral region of the spinal cord, which houses the erection center. This triggers a chain reaction. The nervous system tells the smooth muscle of the penis to relax, the arteries to dilate, and blood to flow more freely. And it doesn't stop there. Some of these points directly influence the pelvic floor muscles, the muscular cradle that supports the penis during an erection, and helps control ejaculation. Gentle stimulation can improve tone and responsiveness, making it easier to maintain firmness after you achieve it. Therefore, the effect of working these pressure points is often twofold. It helps you initiate an erection more easily and also keep it longer. By working the right points, you are essentially bypassing some of the age-related delays and giving your erectile system a direct hands-on boost, like rebooting a computer to clear the sluggishness, refresh the signal, and get the hardware and software working in sync. Done regularly, this type of stimulation can re-educate the erectile reflexes, improve vascular flexibility, and even increase nerve sensitivity over time. Point 1. The base sulcus, or base groove. Point 1. The base sulcus. It sits at the root of your organ, exactly where the shaft of the penis meets the pubic area. To locate it, glide your fingers along the underside of the shaft toward your body. You'll notice a slight groove or indentation, almost like a natural hinge, where the erectile tissue blends with deeper structures anchored to the pelvis. The area may feel a little different from the rest of the shaft, slightly firmer or textured differently, because it's a meeting point for important anatomical structures. Why does this point matter? Just beneath the skin is a dense network of sensory nerve endings, including branches of the dorsal nerve of the penis, in addition to vascular junctions that directly feed the corpora cavernosa. Think of it as a control hub, where nervous and circulatory signals converge. By stimulating this area, you simultaneously light up the nerve and vascular lines, encouraging better communication between the brain, spinal cord, and the organ. How to do it? Place your thumb directly on the base sulcus, while your other fingers cup the back of the shaft. Start with moderate pressure, enough to feel the tissue beneath your thumb, but never to the point of pain. Make small, slow circles, allowing the warmth of your touch to spread. As you work the area, you can slightly increase the firmness of the pressure, especially if you feel the tissue softening and relaxing. You may notice a pleasant warmth, a subtle tingling, or even a filling sensation. These are signs that blood flow is increasing and the erectile tissue is becoming more responsive. If you don't feel much at first, don't worry. Consistency is key. Daily practice increases sensitivity and makes the results more noticeable. For best results, work this point every morning, ideally before getting out of bed, when the body is naturally relaxed, or in a warm shower. Point 2. The perineum, the perineal point. Point 2. The perineum, the perineal point, doesn't lie on the shaft, but in a slightly hidden and often neglected area. The perineum, the soft, elastic tissue between the scrotum and the anus. Many men ignore it, but for erection strength and control, it is a real powerhouse. Why? Because it sits directly over the bulbospongiosus muscle. This is a key player in maintaining firmness during excitement. This muscle helps trap blood inside the penis. Think of it as a natural clamp that prevents blood from leaving too quickly. With age, if it's not activated, it can lose strength. By applying targeted pressure and massage to this point, you reflexively activate the muscle. It's like giving it a workout without needing a full set of Kegel exercises. How to locate and work it. Sit comfortably or lie down with your knees slightly apart. With 2 fingers, index and middle, press gently but firmly into the center of the perineum. It shouldn't hurt. You should just feel the response of the underlying muscle. Make slow, deliberate circles, staying in the sweet spot. You may notice subtle sensations growing, a gentle warmth radiating toward the penis, or a discreet pulsing as circulation improves. Dedicate 2 to 3 minutes here with stable, controlled touch. To reinforce, combine this with slight pelvic floor exercises, Kegels, before or after. This combination doesn't just help in the moment. It trains the muscle to contract with more power during excitement, making erections fuller and more reliable over time. Point 3. The corona of the glans. The corona of the glans is located in one of the most sensitive regions of male anatomy, right below the glans head, more specifically in the raised ring where the glans meets the shaft, the corona. This area is loaded with sensory nerve endings. They are the main messengers that send signals of excitement to the erection center in the sacral spinal cord. When stimulated with the right balance of pressure and rhythm, it can increase nerve responsiveness, making it easier for excitement to transition to a full erection. Here, less is more. Stimulation that is too intense can overload the nerves and have the opposite effect. How to do it? Gently hold the penis with your thumb and index finger positioned on either side of the corona. Give the ring a light pinch and hold for about 5 seconds. Then, slowly release. Repeat for 1 minute, maintaining firm but comfortable pressure. Next, switch to slow circular movements around the entire circumference of the corona for another 1 minute, letting your fingers glide just enough to stimulate the endings without causing irritating friction. Over time, this moderate rhythmic stimulation can lead to stronger and more frequent morning erections and improved overall sensitivity during intimacy. Recommended frequency and conclusion. Recommended frequency. The full routine. Base sulcus for up to 90 seconds of small, steady circles until you feel the area warm and responsive. Perineal point. 2 minutes of slow, deliberate pressure and massage to activate the pelvic floor and deepen circulation. Corona of the glans, 2 minutes. First, holding and releasing in cycles of up to 5 seconds, then gentle circles. Done consecutively, these steps stimulate blood flow, engage muscular support, and sharpen nerve communication, the 3 essential elements for firmer, more reliable morning erections. This is not a magic, overnight button. The body needs time to readapt and coordinate vessels, muscles, and nerves again. However, many men notice subtle but encouraging changes in 2 to 4 weeks. More warmth and fullness in the morning, erections that last a little longer, and a general sense of pelvic vitality. For lasting results, combine this daily routine with healthy habits. Adequate hydration throughout the day maintains blood volume and circulation. Regular pelvic floor exercises, Kegels, and nutrition favorable to vascular and nervous health are also essential. When these steps enter your daily rhythm, the benefits tend to multiply, the points become more responsive, circulation improves, and the body remembers how it should perform. Gentlemen, you do not have to accept weak or absent morning erections as an inevitable part of aging. The body can still respond. It just needs the right stimulation and support. By pressing these 3 points daily, you can re-educate the nerves, restore circulation, and reclaim that morning confidence without drugs or risky procedures. If this was useful to you, incorporate it into your routine and tell me how it goes. And remember, sexual health reflects global health. Every step toward better circulation and better muscle tone also yields dividends in the bedroom and beyond.